we've examined data about disparities in health outcome across countries. What we've seen is that there are significant differences in health between developed and developing countries. But how do we define health? The World Health Organization defines health as the state of complete mental, physical, and social well being, not just the absence of disease. This definition by nature is very holistic and takes a broader view of health. But by nature, it is a very ambiguous definition and it makes it hard to quantify the level of health outcomes across countries. Economists use two measures to get a snapshot of the absence of health. The first measure is mortality, which looks at the death rate in various segments of the population, and the second measure is morbidity, which looks at the rates of diseases and illnesses. These two variables can be combined to get a summary measure, which is the life expectancy of birth. It is how long can an individual born in a country expect to live at a given point in time. Over time, we have seen that life expectancy has been increasing. Increases in food production in Europe and improved distribution over the past few centuries has significantly been attributed to the elimination of famines. This is true even for Asia, though there have been some exceptions of famines in the past. Even though we have eliminated famines, malnutrition still is a problem in a lot of the developing world. Malnutrition results in people being susceptible to disease and infection. Rising income levels overall have been attributed to improved life expectancy as a result of improved housing and sanitation. These facets have resulted in significantly improved health outcomes across countries. But even if we hold income constant, life expectancy has still been increasing. Thus, health does depend on factors other than income. There is a strong negative correlation between GDP per capita in countries, which is a measure of development, and child mortality. In countries with per capita income below $2,000, on an average, 140 children out of 1,000 do not live beyond their fifth birthday. In developed countries, however, this number is almost negligible. Measures of health are also related to poverty. Countries with low poverty rates have high life expectancy. The question then is, what causes what? Higher incomes improve health. With higher incomes, people have access to better nutrition. Poor households can afford clean water and basic sanitation. They can also have access to shelter. More importantly, households can afford health care. For instance, communicable disease, especially waterborne disease, are a big cause of death in developing countries. Children suffering from this disease quite often face a threat of dehydration. Oral rehydration therapy, which prevents dehydration, costs only 33 cents per treatment. But some poor households living at $1 a day may not even be able to afford this inexpensive treatment to save the lives of their kids. Improved incomes also matter for society as a whole. With higher income, governments can build better health infrastructure. For example, in sub-Saharan Africa, 2% of GDP would translate into $37 of spending in health per person. On the other hand, because Latin America has a much higher average GDP, a 2% of GDP dedicated to healthcare in that country or in those nations would translate into $153 of healthcare spending per person. These are significant differences which can result in vastly different access to health for citizens of each of these regions. Apart from the level of income, income distribution is also important. Countries having a lopsided income distribution will have very disparate access to healthcare among its citizens. But health will also result in higher income levels. For instance, healthier people are more productive and more energetic at work, and as a result, they will have higher income levels. Families' health can also impact children's health and education. Children's education, in turn, will have an impact on their productivity when they join the workforce. Not only does health impact current income, it also has an impact on future income, both for individuals and for nation through investment channels. People expecting to live longer because of good health have a greater incentive to make long term investment decisions on their farms, businesses, and also spend money in acquiring skills and human capital. If a country is successful in reducing or combating disease, it can then focus its resources towards more productive uses. And a healthy workforce is also a good incentive for foreign companies to make investments in that country, since they will have access to productive, healthy workforce and can get more from the workers. There are several tangible benefits to improved health outcomes. Devising policies to promote health is really tricky, especially in developing countries. This is because the public funds in developing countries are already fighting for various uses, so it is difficult to allocate adequate resources for health. However, policies that developing countries implement to improve health have to be based on their local country and regional needs, and a one size fits all approach does not work, especially in healthcare. There's, however, an insight that in developing countries, most fatalities are caused by communicable diseases. As a first step of action, governments should implement plans to fight the spread of these diseases, especially among children. The crucial role that improved health plays in combating extreme poverty is also explicitly recognized in the Millennium Development Goals, where three of the eight goals focus exclusively on health. Specifically, one of the goals of MDG is to reduce child mortality. The other goal is to improve maternal health. And finally, the third goal devoted to health outcomes is to combat HIV/AIDS, malaria, and other communicable diseases. Developing countries achieve these three goals and also to monitor their progress. The United Nations set up a task force on child and maternal health, which made several recommendations on improving health outcomes. Some of these recommendations include improving healthcare systems, especially at the district level, with priority given to child and maternal health goals. They also highlighted the importance of strengthening finances because these healthcare systems will require significant sources of funding. These developing countries also face tremendous shortage in human resources. The task force recommended devoting resources towards training healthcare workforce. They do not have to be medical doctors, but even nurses, registered practitioners, midwives, which can address healthcare needs at the very source. Another goal was to fight child mortality. Children healthcare interventions should be scaled up to 100% coverage. To mortality is maternal health or maternal mortality. The task force also recommended that maternal mortality strategies should focus on building a functioning primary healthcare system at the community level. So there was a lot of focus on local healthcare provision at rural and community level disaggregation. It is often argued that in developing countries, either they can focus on fighting poverty or improving health. The task force recommended that these two goals not be seen as competing but as complementary. In other words, policies aimed at poverty reduction should also try to reinforce and strengthen the existing healthcare infrastructure in the country and not undermine it. Finally, the task force also highlighted the sharing of information systems across countries. Information is essential in building an equitable health system. So these several recommendations can go a long way in helping countries and governments fashion policies which can result in improved health outcomes of their people.